All right, I think it's time to begin. Let's get into it. Welcome everyone who's watching on social media on our various platforms. This is the International Women's Day 2021 webinar. This day's focus this year is women in leadership. Now, the world over, the International Women's Day is celebrated globally to, bring focus to women's economic, political, social achievements, among various other aspects, and organization, governments, even the media, corporations come together so that they can focus on these matters and take stock of what the status is as far as women are concerned, and of course, chart the way forward, see how better we can do to achieve the goals that we have. The theme for the 2021 Women's International Day, of course, is Women in Leadership, and the focus is achieving an equal future in a COVID-19 world. This day is being celebrated in a very unique way because women across the world are facing unique challenges given the pandemic that every single country in the world has been touched by, and therefore this makes it quite unique. Now, this year, as countries and communities start to slowly recover from the devastating pandemic, we have the chance to finally end the exclusion and marginalization of women and girls, but to do that, we need immediate action. So women must have the opportunity to play a full role in shaping the pivotal decisions being made as far when it comes to their matters and their rights. And now, as countries respond and recover from COVID-19 pandemic, choices that will affect their well-being are being made, and of course, we have to focus on that. The objective of this webinar today is to explore opportunities and challenges faced by women in advocating for an equal future, especially for women who stand at the frontal point. And we're talking about the caregivers, innovators, community organizers. You're talking about people who are putting their lives, women who are putting their lives on the line to ensure that they are of service, and effective national leaders that have been charting the way forward in battling the COVID-19 pandemic in their various capacities. Now, before we get into the discussions that we shall be having today, I would like to acknowledge our sponsors, and that has to be the CRR, that's the Center for Reproductive Rights Kenya. We have RHNK, APHRC, which is the African Population and Health Research Center, as well as Maristops Kenya. Now, we have a panel that is joining us today that is quite special, women who are in leadership, quite fitting with the theme of the day. And I'll just allow me to introduce them for you so that you can get to know them and what they're about, and of course, understand why they are pivotal to the discussion that we are having today. Now, the first panelist that I'm going to introduce is Evelyn Opondo. She is a Senior Regional Director, Center for Reproductive Rights, Africa. Evelyn joined the center in 2013 and coordinates the work of the African team, focusing on policy advocacy, development and implementation strategies, project strategy development, and strategic litigation throughout Africa. Welcome to the conversation, Ms. Opondo. We also have Sophie Hode, who is the County Director at Maristops Kenya, MSK. Prior to joining MSK in 2019, she was the Country Director for the Nepal program, during which time the program saw significant growth. She is a British citizen. Sophie possesses both managerial and strategic skills. She is a seasoned public health professional with a strong track record of maternal and newborn health, nutrition, emergency preparedness, and interventions. Sophie has over 15 years in professional health management experience. Prior to joining MSI, Sophie worked in both NGOs such as Doctors Without Borders and the Clinton Health Access Initiative, and the private sector, including Rolls-Royce Aerospace, British Biocell, and NRAF Nonius. Sophie also spent some time in the British Health Service, in the British National Health Service, in leadership roles. She is thrilled to be in Kenya and looking forward to working with all partners of Maris Stops. And thank you so much and welcome for joining us. Welcome to the conversation. We also have Dr. Kathryn Kiyobutungi, who is the Executive Director, APHRC. Dr. Kathryn, is also another valuable part of this conversation this afternoon. She is the Executive Director at the African Population and Health Research Center. She was formerly the Director of Research and has APHRC has been at that organization in several leadership roles over the past decade, having joined as a postdoctoral fellow in 2006. She holds a PhD in epidemiology and a master in science and community health and health management from the University of Heidelberg. Prior to her graduate studies, Kathryn studied medicine at Makerere University in Kampala, after which she worked as a medical officer in Western Uganda for 3 years. And last but not least, I think this is the youngest panelist we have this afternoon. This is Lisa Marianne, who is the youth leader or young women leader, RHNK youth advocate as well. Lisa Marianne is a youth advocate pushing for meaningful youth and women engagement in civil and political spaces for informed decision making. She believes in transformative leadership that empowers community members to be positive. She believes in of course, as well, this she does through community-based organization called Mothers and Daughters Care Initiative that focuses on adolescent and young women, SRHR empowerment and advocacy. So if you're joining us via social media, the hashtag to use is of course, the Kenya Women Leadership. That's the hashtag. You can also use International Women's Day as your hashtag so that you can be a part of the conversation and we can have your contribution and views as well as we go on. Without much further ado, I think we should just get into the discussions that we have on for you this afternoon. And first of all, I think I'm going to pose my questions, first of all, to Ms. Evelyn, and just give me a second so that I can organize my material. And I'll start off with Ms. Evelyn Opondo. And my question to you this evening to start us off is, how is the International Women's Day celebration unique, especially given that this year, all the way from last year, we have been facing a pandemic that has brought on various challenges, but some challenges are quite specific to women. So how is this year unique in your view?
Thank you, Trix. This year's celebration is unique because we find ourselves globally at a very unique point because of the pandemic. And we do know and we have seen that the pandemic has affected women in ways that is beyond the effect that we are seeing on men. And so it's really important that this year's theme is specific to COVID, and we are looking at how that has impacted women. We have seen a lot of economic challenges for women because a lot of we do know that women are economically challenged in many ways, majority of women, and COVID has made this even worse for women. We have also seen the increased care burden. Naturally, women take care of families and the society, but with COVID, this has increased, whether it's in our own families or even within society. And therefore, we are seeing increased labor that is unpaid for by women. And we've also seen, the effect on women because of women's reproductive capabilities. We have seen, for instance, the increased teenage pregnancies for girls who are in school, and what then follows that, which is, increased child marriages. We've also seen increased female genital mutilation. And what this means then, that in the long run, a lot of the gains that we made over the years, the gender gains that we made, the number of girls in schools, the number of women who are accessing reproductive healthcare services, and all of this are threatened unless we really do a lot more to address and to reach at least where we had reached, and in fact with the objective of gaining traction and growing in all of these fields.
Thank you very much, Ms. Opondo. I'd also pose this same question to Dr. Kiyobutungi. How do you see this year being? Particularly special for women, as we celebrate the International Women's Day and also battle COVID-19? What specific things have you noted that are a challenge to women?
I mean, I think from a personal level, I was trying to reflect where I was this time last year. And
Right.
then I remembered that about 2 days from now, I took a trip to the UK, spent 3 days there, and then returned. And a few days after that, the first case was diagnosed in Nairobi, and then Kenya was closed up. And what followed was really a terrifying few months where by all indications, what we expected COVID-19 to affect Africa. So it was a terrifying time to be alive and to be, not knowing what was going to happen in the next few months. So for me, the fact that we've sort of survived and we are thriving to a certain extent, in spite of all the pain and loss that is going on in the world, the fact that we've adapted, we've learned new things. It has been tough. I think Evelyn has talked about all the challenges that women are facing. But I think it has also been, I think, a time of self-discovery and recognizing that all of us have hidden strengths and maybe hidden talents that have been forced to come up. So it's unique from that perspective. I don't think the world as we know it has ever experienced such a thing, where every single part of the world is affected and you don't have anywhere to run to, anyone to run to. But somehow I think we've grown, we've become wiser, and hopefully that wisdom and growth will serve us better even after the pandemic has ended. So the challenges are immense, and I don't think I can list them again. But among those challenges, I think there are also huge opportunities. So we celebrate life, we celebrate strength, we celebrate resilience, and we celebrate hope for the future.
Absolutely. You've taken a very positive angle to it, which is true. A lot of people have learned from this particular period, which is difficult, and picked up some things that will make them different, and we're never going to be the same again, indeed. And far from the corrosion that we have seen in terms of human rights or challenges that have occurred, and also the positive, I like the take of Sophie Hodder, who is the country director at Maristops Kenya. Could you tell us what your view is in terms of the uniqueness of this year's International Women's Day?
Yeah, it's a very exciting year. Exactly as my colleagues have talked about, it's been particularly challenging. And as always in crises, women and girls are disproportionately affected. What's also been really challenging for us as a service delivery partner for in Kenya is we've seen a shift of focus of some of the funding and also some of the energy in the health sector as well. So when COVID first hit, everyone was very, very alarmed, as is right. And so a lot of the health service delivery was refocused to COVID care and treatment, but also to a lot of the funding that was coming from international donors as well as domestically. And so that was one of the biggest challenges we saw, was how to ensure that sexual and reproductive health stays very high on the agenda, because the needs haven't gone away at all and are really significant. And like we were saying, women and girls' needs are disproportionately affected. People's economic power has been really challenged by this. So many people have lost their jobs, and particularly women. And so really what we've seen is this disproportionate effect, and that is really exacerbated if we see women and girls in a situation where they have an unwanted pregnancy and are not able to access the sexual and reproductive health services that they would have otherwise been able to access pre-COVID. So we've worked really hard as an organisation to do that. But this really does make it a unique International Women's Day for that. We really need to refocus our attention and not forget all the knock-on effects that COVID has had. We've seen particularly our younger population home from school, and that's been very, very challenging. Like my colleague Evelyn was saying, that's really put a burden on women in terms of their domestic responsibilities. But also we've seen, very sadly, an increase in gender-based violence, where lots of families have been locked in at home, and that's a real concern to us as well. So it's a very unique day. It's a great opportunity for us all to reflect on this, reflect on the incredible job women do every day to basically keep the world going round, and that's really critical. And it's a great opportunity today to celebrate and reflect on that as well.
Thank you very much. Marianne, your perspective from being a youth leader, what is your perspective on this year's International Women's Day and its uniqueness given the background of COVID-19?
Thank you, Trix. In my opinion, I think this year is very, very unique, and we should celebrate International Women's Day all over the world with so much zeal, because I believe, despite the fact that last year was so challenging and it increased the vulnerabilities of women during the period of the pandemic, I've witnessed young women in my community being able to survive GBV, being able uh, to thrive through teenage pregnancies and some going back to school. So in my view, I'm thinking, despite all the challenges that women and girls have faced during the pandemic period, they have been able to survive, and not just survive but thrive and rise like phoenixes. And I think that this year's International Women's Day, we need to be able to reanalyze the potential of women to take up leadership positions, because the fact that they were able to, come through fearless and stronger than ever despite the pandemic already shows that women are conquerors, women can make great leaders. And if you give a woman anything small, or no matter what challenge you throw her way, she will always come back, fearless and forceful, and she'll always make it work. So this is my view from my community's perspective. Yeah.
Trixie, on mute.
Sorry about that. Thank you very much, Marianne. Now, for those who are joining us via social media, remember you can be a part of the conversation. The hashtag is Kenya Women Leaders, as well as International Women's Day. Tell us what you think, and of course, be a part of the conversation so that we're just not talking to ourselves. Now, my next question, I'll throw it back to Ms. Opondo. What are you doing to ensure that African women, especially, are the underserved and those living in hard to reach areas access quality services?
Thank you, Trix. Now, when the pandemic broke out last year, none of us really understood COVID. None of us knew what the impact would be, or how women, men, or the society as a whole would be affected. So one of the things that we are doing is documenting the impact of COVID on sexual reproductive health rights in about 5 or 6 countries. And we are doing this with a number of partners, including APHRC, whose executive director is here, in Reproductive Health Network. And this is important because once we have that evidence, then we can use that to advocate for policy adjustment or policy reforms. But first, we need to know what the impact was on the ground. The other thing that we are doing is also just looking at how, governments and even civil society, how all of us responded to the pandemic. And the idea is for us to learn from get the lessons from how we responded, and hopefully learn so that next time we know how we approach a crisis. We are also amplifying the voices of women, particularly, the women on the ground, those that are underserved and those who are marginalized. Their voices should go to inform what policymakers, the decisions that policymakers end up with, whether it's at the national level or at the regional and even the global level. So we are connecting women and girls to these spaces so that their experiences influence the policies that we end up with. Finally, I would say that we are working with partners. A number of partners are doing different things, including engaging the government directly. I believe, such as the Maristops Kenya, engaging government directly and just asking how can we better address such situations. Thank you.
Yeah, thank you very much, Ms. Opondo. Just a quick follow-up on that. I mean, COVID-19 is an animal that nobody understood before it was upon us. So how have you faced some challenges in that response that is quite needed, that should be swift, but at the same time, you really don't know how you should act in terms of a pandemic, a virus that is something that is new to the whole world, so you have no reference to?
Yes, we have faced a lot of challenges, even as organizations. When this at the onset of the pandemic, we did not know, how to react or how long this was going to take. And of course, you have to also protect people within the organization. And some of the things that changed for a number of civil society organizations was even the working styles. We all had to move and work from home, which came with a lot of challenges because, as uh, uh, internet challenges for a number of us in Africa, and so that made working different. It was really difficult even to build solidarity and to do joint advocacy. And during that period, we saw a number of anti reproductive rights groups really pushing
Yes.
hard. And it was really difficult for us to organize quickly, but we eventually did.
Okay, Dr. Kathryn, your take as well on how or on how you have been able to give those services that are much needed in this very unique atmosphere.
So our role really is to generate evidence. So we are primarily a research organization, and we work
Yes.
with partners like those that are on the call, and we generate evidence, and then we try to work with them to see of what value the evidence can be in informing their decisions. But increasingly, we've taken an approach where we try to meet the demand of our partners rather than sort of pushing the evidence that we have. So really, what COVID-19 forced us to do, as Evelyn has said, is to change the way we work. For about 5 months, we suspended our data collection activities. So from March to August, there was no data collection activity at all. But then after that, we figured out that it can be done and done safely. So we had to resume our work, and then, of course, the engagement with partners. But we've also grown a lot in the virtual space. So we figured out how to work with policymakers, with parliamentarians virtually, and have virtual meetings. But then over time, depending on the epidemiological situation, also dare to have face-to-face interactions. So as I've said, it's been a learning experience, and our staff, of course, have all been working from home. Even up to now, the default is working from home. We're still working from home until we feel that it's safe for everybody to commute every single day without the risk of infection. But that has come with its own challenges, and somehow, as an institution, we've tried to mitigate them by supporting staff to make the pain of working from home a little bit easier.
Okay, and I'll skip over to Marianne. How have you worked towards ensuring that you continue giving services at the same time ducking the challenges of COVID-19?
Well, COVID-19 created an opportunity for innovation and creativity. And as a youth advocate through RNHK, we were able to maximize on our digital spaces and our digital platforms so that we are able to reach out to more young people and women at the community level. We've also been able to partner with key community stakeholders such as community health volunteers and community health workers who are able to assist us, to reach to increase our reach for women and girls who need SRHR services, and also various innovations such as telemedicine. Through the Nena na Binti platform of RNHK, we've been able to increase our reach for women who need SRHR services and commodities, and also maximizing on opportunities such as delivery services for some of these commodities, because with COVID, the restrictions and the human interaction restrictions were high. So taking advantage of such opportunities of such as delivering commodities was a great win for us, and also uh, online counseling for women who need it. For women experiencing GBV, they were able to report via our toll-free line. So I think we have managed to work through COVID, and actually it has helped us increase our reach, because sometimes when you do one-on-one outreach activities, it limits you. But maximizing on digital spaces and partnering with community champions and community health volunteers has really enabled us to provide women and girls with the adequate services that they need, as well as key information on SRHR. Yes.
Trix, you're muted.
Sorry about that. Now, as African leaders, this is from Ms. Opondo, as African leaders are African leaders doing enough with regards to investing in reproductive health services? And I do believe I have skipped one of our panelists. Sorry about that. I'd like you to actually go ahead and make your contribution on our previous question, which was what are you doing to ensure that African women specifically, the underserved and those living in hard to reach areas, access quality services? Then we can go on to whether or not African leaders are investing in reproductive health services.
Sure, thank you. So, Kenya, I'm incredibly proud to say, has not paused any of its services throughout COVID. What we managed to do was work really closely with the county governments, who realised the importance of the service delivery that we were offering. And we have 19 clinics and hospitals across the country, including a maternity hospital here in Nairobi, in Eastleigh. And we have outreach teams which go out and offer services, particularly in rural and hard to reach communities. And we have a number of teams doing public sector support, where we're going into public facilities and helping with training and community planning and ensuring that sexual and reproductive health services are really widely available. And then, of course, we're also selling our own brands of reproductive health products as well. So we managed to stay open, keep our doors open, keep offering services throughout this pandemic. But what we have seen, which has been really interesting, is a 40% drop in the normal clients that are coming through our doors. And when we've had a look into this, what we've realised is, despite being open, there has been assumption that health services outside of COVID have closed down. And we asked our clients, what is your perception? And this is what we found, that they were concerned that we were actually closed. So we've done huge efforts lately of making sure that we're open and that we're open for service delivery. And also we found that people are very concerned about COVID. So another thing that we've done is really invest in our knowledge and our use of personal protective equipment, PPEs, making sure that our staff are safe, making sure that our clients are safe, making sure that we have hand sanitizer, that we're doing deep cleaning of our facilities, and all of the necessary things to make sure that we can continue getting safe services and meaning that we're low risk to our clients who are coming through our door.
Yeah, and because this is within your wheelhouse very directly, I'd like, before going to Ms. Opondo, you to respond to the question, are African leaders doing enough with regards to giving reproductive health services to their people?
So I often joke that if reproductive health faced men, or it would be a whole different ballgame. And if men were having babies, it'd be a very different situation.
Yes.
And That is my honest answer. I think that many of our leaders are men, and that essentially means it's not as much of a focus as it should be. We know that the hundreds of years that women have come second in the gender race, and it's really quite frustrating. So no, my answer is it hasn't. There are lots of conflicts at the moment, we know, and like I was saying before, there's lots of investment, of course, in COVID and the vaccine and PPEs and all the necessary things that go with keeping the country as safe as possible. But the investment isn't there for sexual and reproductive health, and it really does need to be, because it's a real priority. And we've seen when people are affected by something like a pandemic and are less resilient in terms of economic power, then having choice over your reproductive health is incredibly important, and so it really shouldn't be secondary.
Okay, Ms. Opondo, now on to you. What do you think of how African leaders are doing in terms of delivering reproductive health services to their people?
I completely agree with Sophie that the African governments are not doing enough, whether it's in family planning, maternal health service, and even things like abortion. They are not doing enough. In certain instances, such as family planning, we see a lot of rhetoric, and you'd think there's goodwill. But talk alone is not enough. If you do not put budget behind what you're saying, if you do not put, administrative procedures, that is problematic. So we are not seeing our governments investing enough in terms of budgets on, say, for example, family planning, but also beyond allocating budget. We know they rely quite a bit on donors for family planning, for example. But beyond that, on things such as, the reduction of unsafe abortion, in Kenya, for example, we are still pushing and fighting to have guidelines. These are just administrative tools that help providers, navigate health services. And if that is that difficult, when we are talking money, governments can say maybe they don't have money, maybe they have so many needs. But administrative tools, guidelines, why are you having problems with that? And even on maternal health services, we see a lot of good talk, but we are not seeing, actual action that would make us reduce the number of women who are dying from, maternal health related things.
Okay, Dr. Kathryn, do you agree that we are doing poorly as far as leadership is concerned in giving reproductive health services to the people?
I mean, I think if you read the headlines a few months back, there's the thing about teenage pregnancy. Teenage pregnancy everywhere. Every single country is talking about teenage pregnancy. And now the schools have opened, and there are estimates of hundreds of thousands of girls who are not returning to school because they are pregnant. And the response at first was like, in Kenya, oh, the data is not right. So I don't know where that data came from. And it can't be. Okay, yeah, it's right. But so, I think just from that example alone, the fact that young girls, they get out of school and within 3 months, hundreds of thousands of them are pregnant. I think that's already a failure. And the lack of investment into the instruments, the guidelines, the money. But also, I think it has been that COVID has been looked at mostly from the medical perspective. So the response has been dominated by, yes, we should test and we should treat and we should, hand sanitize and wash and all that. But then in actual fact, the fact that, very early on, the alarm was raised about teenage pregnancy, and you don't see like a shift about how do we prevent more girls from getting pregnant. I saw some initiatives about, I don't know, keep your legs closed or whatever it was. And that for me is a failure of leadership, really. And I think the people who work in this space day to day can tell about the policies that are gathering dust on shelves, and the back and forth, one step forward, 2 steps back on developing guidelines and approving them. So this is, of course, a Kenyan example, but generally speaking, I think there's been a failure of leadership in issues of sexual reproductive health during the pandemic.
Okay. I'd like your perspective, Marianne, as well. You are closer to that demographic that we're talking about, the teenagers who have been all over the news about the pregnancies. They were away from school for 10 months. When they came back, many of them were missing. And the reason was that teenage pregnancies. So when you look at how COVID-19 has been handled and our leaders, do you think that they are doing enough to combat, or rather to provide reproductive health services, or is there a gap, as the other panelists have pointed out, in the delivery of those services?
Thank you, Trix. It's actually really, really unfortunate that during the COVID crisis, sexual and reproductive health needs of women and girls was not prioritized at all. In fact, if you went to many government facilities, some of these services were not being offered at all, at all. And recently, I was in a committee for UHC in one of the counties that was piloting UHC. And when we brought up the issue of prioritizing youth friendly services for adolescent girls and young women, a government official bluntly told us that that is a donor funded activity, and the government and the county and that particular county government was not going to prioritize that issue. So when you receive such feedback from our leaders, it becomes, mind blowing in a way that's not so positive, because you wonder, this is a county that had thousands of girls not returning back to school. This is a county that had thousands of adolescent girls being victims of sexual gender-based violence and also teen pregnancies. So you wonder if they're completely relying on donor funding, and them as a county, yet they have the health budget, cannot prioritize this as an issue, then where is the future of our young girls? That means that they do not prioritize the future of young women at all in that particular community, which is sad. And in my opinion, I think we need to come out guns blazing as um, women representatives in our various capacities to ensure that youth friendly services and SRHR services are prioritized in our government facilities. And if they
No.
cannot create YFS centers for young people, then let them integrate the YFS services in their daily services at the health facilities. Whether it is integrating it into the new UHC uh, policies that's being rolled out in the different counties, or the existing services at various government facilities, let us make sure that we prioritize this as an issue and not see it as a morality issue and tell young girls to abstain, but rather address it hands on and make sure that commodities such as family planning, commodities such as condoms, pills, they're all readily available for women and girls.
Yeah, I actually wanted to ask you about that. The campaigns with the titles such as "Close Your Legs." What is your take on, the fact that that would be the approach, as opposed to, provision of services and, maybe pills and what have you? What do you think needs to be done to change that, so that we can view reproductive health as an issue about service provision, as opposed to our morals as a society?
In my opinion, I think such campaigns are extremely derogatory for women because we are not facing this issue from a realistic perspective, but rather from either a cultural or religious perspective, which, in my view, it's having tunnel vision, and we are we are we are putting our girls in a situation where, instead of helping them, we are actually making them suffer all the more. For example, on the issue of teen pregnancies, if adolescents would easily access youth friendly services and SRHR commodities at all our government facilities, then we would not be having the increase of teen pregnancies. And actually, we'd be securing the future of these young girls, because with accurate information about their sexuality, then they'll be able to take proper precaution and also be able to get adequate and affordable services for them to be able to, stay in school, maintain their health, protect themselves, and even they'll be able to make proper and informed decisions. So I think we cannot degrade our women and girls by telling them this is a morality issue, but rather we need to protect their future by making sure that these services are easily accessible for them, and they should not be donor funded only, but the government ought to prioritize, both the county government and the national government. They need to prioritize this as an issue, because when we're
Mm-hmm.
looking at having women representation and women leadership, these young girls are our future. If we don't protect their future right now by ensuring that they are able to access such services, then we will not have representation in the years to come from these young girls, who most of them have very high potential and they're really smart and really sharp. So we need to ensure that also CSC is really key for adolescent girls in schools, because most of them they rely on myths and misconceptions about SRHR commodities and about sex in general. Hence, they make uninformed decisions which put their health and their lives at risk. So I think it's important that we prioritize CSC, and we prioritize access of SRHR commodities, and we need to view this with a non-judgmental, attitude. Let us be
Mm-hmm.
youth-friendly. Yes.
Yeah. Yeah, okay. Thank you very much, Mary Ann, speaking out for the youth there. And that is really in line with the theme of this year, Women in Leadership Achieving an Equal Future in a COVID-19 World. Equality would serve us better if that was achieved. Now, if you're just joining us on social media, the hashtag is IWD 2021 Kenya, KE rather, and the International Women's Day is what 2021 is what is bringing us all together. And that is what we are basing our conversation today. Is just a brief reintroduction of our panelists. If you're just joining us, we are with Evelyn Opondo, who's a Senior Regional Director of Africa Center for Reproductive Health, CRR. And then we have Dr. Kathryn Kiyobutungi, who's Executive Director, African Population and Health Research Center, APHRC. Sophie Hodder is the Country Director of Maristops Kenya, MSK. And Lisa Marianne is a Young Woman Leader, RHNK Youth Advocate. Thank you for continuing on. Be a part of the conversation. Leave your comments on Facebook and Twitter and be a part of it. Ask your own questions and we'll see if you can be a part of this conversation as well. Now, I'd like to pose a few questions to each of our panelists this afternoon, and I'll start with you, Ms. Evelyn Opondo. Now, in your view, how has COVID, I know you have already touched a bit on this, but how has COVID-19 pandemic specifically infringed on the rights of women and girls of reproductive age?
Thank you. For the period since the declaration of the first COVID case in Kenya, and indeed in many African countries, we've seen a lot of violations. We saw a lot of pregnant women who ended up dying because they could not access health facilities. And some of this was related to the restrictions in movement. And, because a lot of people also didn't clearly understand the curfews and all of that. And so did not go to health facilities until it was either too late, or maybe health facilities were so far from them and they could not, reach there in time or even get transportation to those health facilities. And we saw a number of women dying because they could not access the health facilities. We also saw a number of women and girls opting not to go to health facilities for reproductive health services. Again, this was associated with stigma in those facilities, but also, how COVID had been stigmatized to the extent that people feared even finding out that they were COVID positive. We have, of course, talked about the increased teenage pregnancies, and we've talked about increased child marriages in FGM. I think just to cap it all, the bigger challenge was also just the fact that while there was a lot of effort to try to contain the spread of of COVID, there was a lot of human rights violations, even beyond sexual reproductive health rights. We saw a number of people who were beaten to death by police, for instance, in their attempt to enforce the COVID regulations. And so we have seen a number of human rights violations, and we are hoping that governments have learned from these violations, and if there's ever any crisis, any pandemic, or anything that needs quick and urgent action, that they will not repeat the sort of mistakes that we have seen. Thank you.
There's always the argument, Ms. Opondo, that the pandemic just brought out what was already happening underneath just right under our noses. What do you say to that when it comes to these violations of human rights, particularly towards women?
That's true, because, for example, police brutality is not a new thing. They just used that, they took the opportunity to really beat up people, people who were out trying to get food on their tables, trying to get their means, and were, slightly late. They were beaten mercilessly, and some of them we saw taken to, the restrictions centers. Which was not of any help. But also, when you look at, for example, the women who are dying, who are pregnant and dying in the process of giving birth, it's because the facilities were, even during the times when we did not have COVID, they did not have facilities near them. These are people who either walked or took days and hours to reach health facilities. And governments really should already be ensuring that these facilities are near them and that facilities are well equipped. But we also saw that even commodities were not available in a lot of government facilities. And so these were problems that we already had, but the pandemic just exacerbated the situation.
Oh. Okay, so as a woman, leader, what are you doing to shine a spotlight against the gross violation of women and girls' rights in a COVID-19 world?
As the Center for Reproductive Rights, like I mentioned, we are documenting the impact of COVID-19. We are amplifying the voices of women, but also, connecting with women from other parts of the world, and really learning and hoping that we can live this, that while the pandemic is over, that we will be stronger than we are today.
Mm-hmm. And in the context of securing reproductive health autonomy in Africa for girls and women of reproductive age, what must the leaders who have the power, the resources, and all else that is needed to ensure this is realized, what must they do, and what must they also stop doing to ensure that we reach these goals that we have for reproductive health for girls and women?
Our leaders must make sure that they don't only talk, but they also walk the talk. We see a lot of talk around, for example, maternal health. We keep saying beyond zero. We have all these campaigns, and we don't want any woman to die. But how can you say you don't want any woman to die when you don't want to address unsafe abortion? There are too many women and girls dying from unsafe abortion. We really must look at maternal health and sexual reproductive health rights, not just right, but healthcare comprehensively, and look at all, there's a lot that we can do to prevent even unintended pregnancies. There's a lot that we can do to prevent unsafe abortions, and even to prevent those deaths. But we are not in that. We are not doing everything that we can do. And so I would say that our leaders need to commit resources for this. They need to establish laws, policies. They need to speak, encourage people to seek these services, but also to create awareness where these laws and policies exist. Beyond that, we need the actual services that are not, when we go to a health facility, we do not want services that are stigmatized. People don't go to facilities because services are stigmatized. This is why a lot of people end up in private facilities such as Maristops Kenya, because there you will receive services without being judged. And we also need services that are of quality and accessible and affordable, and acceptable, even to the cultures, and sensitive to the people who are receiving those services.
Right. And just to tag on to that particular question, earlier on we were talking, Marianne pointed out that this is not a morality issue, it is a service provision issue. So when we talk about leadership, what is your stand in terms of the church, because this is one of the elements that actually people look up to when it comes to such issues? Where does the religion and the church stand when it comes to ensuring that reproductive health rights are provided, are secured? And of course, these are things that people are aware are not about your morals, but about our physical bodies and what we are entitled to as women.
I mean, we all have a role to play. The church has a role. So do we. Medics have a role. The schools have a role. The girls and their parents also have a role. There is no one shoe fit all, because women are differently situated. They find themselves in different spaces. And so what I would say is, we have to have a multiplicity of strategies. We need to talk about how we prevent, for example, an intended pregnancy, because we've seen a lot of the churches are pushing back, particularly on sexuality education. They do not want sexuality education. They do not want access to safe abortion.
Yes.
These are the key areas that they're pushing back on. But we are, and all they're saying is we need to abstain. But the truth is, first of all, not everybody can abstain. Even within their own churches, even the preachers, not all of them can abstain. And so for those who cannot abstain, how do you deal with that? You need to provide contraceptives. And even if you provided contraceptives to everybody, there will still be a percentage that will get pregnant. And so how do you deal with those? And even if you are abstaining, we are doing all of these things. That has never stopped rapists. They should figure out how they deal with rapists. And when you in spite of all of this, you still get pregnant, how do you deal with that? We are seeing a lot of women dying from unsafe abortion, for example. How do you prevent that? How do you offer them safe alternatives? And then also there are those grounds that are allowed, for example, in the Kenyan Constitution for access to safe abortion. Those must be provided. And so when we see, for example, government shying away from providing these services in government institutions, or even pushing back when providers go out of their way to provide services that are otherwise legal, we are saying no, this should not happen. And religion cannot be the parameters through which decisions are made. In a society, we will have people who are religious, we have people who are not religious, but the government has an obligation to make policies, and implement those policies that protect all types of people, citizens within the nation.
Okay, and last but not least, one more question for you, Ms. Opondo, and I'd like to point out that she is of the Center of Reproductive Rights, not Health, as I had said earlier on. And in your quest to advocate for reproductive rights autonomy, what has the center done to impact the lives of poor, vulnerable women and girls in our society?
Well, the Center for Reproductive Rights works at the national level, but also at the regional level and the global level. We work with partners towards the development of laws and policies. We work with parliamentarians, key government institutions, but we also work towards the implementation of those laws and policies, and that includes challenging where there is lack of implementation. We also, push back on regression that we are seeing. We have seen a lot of forces, for example, that are geared towards ensuring that women and girls are not accessing services. And we are stepping up. We are working with providers. We are providing, legal technical support to people who have dedicated their lives and their professions to providing these services to women and girls. And then, of course, representing women and girls, whether it's in court or just ensuring that they're able to provide services.
Absolutely. Thank you very much, Ms. Opondo, for your answers and bringing context to some of these issues. Now, Dr. Kathryn Kiyobutungi, given that we do have the theme of women in leadership, achieving an equal future in a COVID-19 world, I'll start off with a very loaded question. And just tell us, what does it take for a woman leader in the space of science and research? I'm sure there's a lot that women in this space go through. So just tell us what it takes in today's world.
So as you said, this is a loaded question, and one can decide to approach it from different angles. But the angle that I decided to approach it is that this actually, it doesn't just apply to science and research. I think it applies in many other spheres. That to be a woman leader, you have to first be good from the technical side of things. So if you're to be a scientist and a leader, then you have to be a good scientist. You have to be a good researcher. And research has its own metrics. You have to publish papers, you have to get grants, you have to manage projects, you have to present at conferences. So you have to be good at those to begin with. But then recently, there's an interesting framework which has been developed, which shows that in Africa specifically, research leadership or science leadership is T-shaped. So on the bottom part of the T, the one that goes, the one that's vertical, that's the depth of science. So the papers you publish and the conferences you attend and things like that. But then at the top of the T, the one that's horizontal, is the breadth. And I think this is what's relevant to other women and leaders who want to pursue leadership. That your breadth has to go beyond being a great scientist. You have to learn finance, you have to learn HR, you have to learn communications, you have to learn how to deal with media, you have to learn the legal stuff that happens in your country, you have to learn lots of things, lots and lots and lots of things. So in the end, your day-to-day job stops being writing papers and getting grants. It ends up being those things. But then for you to have the credibility and the ability to know how things should be run, you need the technical side of things. So the T framework, I think, is quite useful. And so what it took for me was to learn, as I said, all those things. I can read financial statements, I can do budgets, I understand HR, I understand audits, I understand communications and so many things. But along the way, these are things which don't just happen naturally. It's that recognition that once you are a great professional in your field, as a leader, you need other things. Your professional expertise alone will not serve you. And so you have to find the avenues and forums in which you learn those things through allyships internally, through going for certain trainings, through immersion into different activities. So that's what it takes. I think the T framework is a good guide for people who aspire to lead.
Okay, and I'll take you back to years ago when you were younger and dreaming of whatever you do as an adult. Did it ever occur to you, or did you ever imagine that you would be a leader in a male-dominated profession?
Actually, to be honest, I never ever thought that this is where I would end up. Very early on, I was destined to be a doctor. I think I've talked about this in other forums. Everybody knew I was going to be a doctor, so there was no question, no discussion. And I went to medical school and I became a doctor. And after practicing for a few years, I wanted to be a pediatrician. So I wanted to go back, do my master's in pediatrics and publish, and be the best pediatrician that there was in Uganda. And then somewhere along the way, I said, I think it's if I would first start do my master's in public health, and then I can come back and do pediatrics. And somebody told me that once you go into public health, you won't come back to clinical practice. And they were right. So I went to do my master's. I got a PhD opportunity. I did it. And then from there, I realized I wanted to be a researcher. So I wanted to be the best non-communicable disease researcher in Africa. But then when I came to my current place of work, I think I can say that leadership maybe sought me and I embraced it. But when I came, my plan was to do my postdoc publish a few papers and get out of there and go and find a job somewhere else where I would be a public health practitioner. But along the way, I said leadership sought me and I embraced it, and here we are.
Okay, and now you've come through it and you've experienced all the things that women go through from your side and of course from the side of those who receive services. Why is gender equality investment and actions important in the sexual and reproductive health space?
I think listening even to the panelists, it is important because there are many decisions being made at different levels. So if you're missing leadership, if you have leadership that is missing women, or you have leadership that has women perhaps who are not, don't have the same power and influence as the men, or you have leadership where there's male dominance. That's why we have these kinds of programs where people are looking at one side of things and not others. I think women the world over, I think the style of leadership women are more empathetic. So if we had more women in leadership positions, whether it was in government, whether it was in ministries, whether it was in service delivery entities, whether it was in advocacy, media, at every level there are so many decisions being made, and I think there will be better decisions, there will be better programs that really understand what women go through, and not following morality and following the money. This is very expensive. Sometimes women, you look at the cost, but you also look at the person and you realize that there's no cost you can attach to human life, and so whatever it takes, it has to be done. And I think the other side, they say, okay, this is too expensive and we cannot do it. So I think the gender equality is important in the kinds of people that occupy the spaces where multiple decisions are being made that ultimately affect women and girls and their sexual reproductive health and rights. So from that perspective, that's why it's important. We need more women in those leadership positions that are going to decide, what kind of policies, what kind of programs, what kind of guidelines, how much money is being allocated, for these kinds of things that affect women.
Okay, and finally, kindly share with us your leading experience in working to collect and share data that are required to inform policy formulations for women and girls' reproductive health. We've already talked about representation and why it's important. What more could you share in your experience in working to collect and share data?
So really, data collection and analyzing it and producing evidence is our bread and butter. We do a lot of other things, but they all revolve around evidence generation and then trying to see how that evidence can be used. So as an institution, the African Population and Health Research Center, we've been doing research. It will be 20 years this year. We're celebrating our 20th anniversary. And over time, our programmatic focus has kept on evolving. And now we have a large portfolio that looks at, we call it population dynamics and reproductive health. So it's a large portfolio that looks at generating evidence, but then making sure that evidence is used around young people's sexual reproductive health, around access to safe abortion services, around sexual and gender identity, because that's what we call the demographic dividend. So beyond our evolution of the program, we've also evolved the way we work. And I think maybe that's where the heart of the question is, that over time we've moved from being an institution that generates evidence and disseminates it and disseminates it and disseminates it, to one that is forging long-term relationships with technocrats in different departments in, let's say, ministries of health, parliament, media, communities. So we are really focused on how do we generate evidence because someone wants it, and because they want it for something, either to do a new policy or to improve a new or an existing one, or to evaluate an existing program. So in that way, that's really our current model that we are emphasizing. And through that, I think you heard from the beginning of the show, the people like Evelyn, we've been working with them, even during the COVID-19, in those areas. So we have also established the rapid response service, mostly in partnership with regional parliamentary groups, SADC, ESC, for now, where when there's any kind of discussion around sexual reproductive health, they would dial and they say, we want this kind of evidence, and then we package it and we send it to them so they can use it in their arguments, for or against a specific bill that is being discussed.
Okay, thank you very much, Dr. Kathryn. Now, if you're watching us via Facebook or whatever social media platform, the hashtag to use is IWD2021KE. Now, over to Sophie Hodder. I'd like to know from you, what keeps you going in pushing for women's reproductive health, especially with restrictive laws and at the same time a very restrictive environment?
Yeah, thank you. So, I mean, what sort of keeps me going and gets me up in the morning is working with such an amazing organisation. I've got tremendous colleagues here at MSK, and we are all in this together. And like Evelyn was saying, we've all got a role to play in this. And what our role really is service delivery. We've made amazing strides, and we do a huge number of services, ensuring that comprehensive women's health is available through all our service delivery points. So that's sort of what really motivates me and keeps me going. And the other thing is, and the slightly negative side as well, is half of pregnancies, nearly half of pregnancies in Kenya were unintended. So the woman didn't actually make a choice at that moment to become pregnant. Now, that's deeply concerning because, of course, we know that drives families into economic hardship. If they didn't intend it, it can put great burden on the woman, on the family as a whole, and the other siblings. And this is what really, really concerns us, and the root causes as to why that would happen. And we know that that's limited access to the contraceptives that women and girls really need. So that's really sort of what motivates me. And also, as we think about International Women's Day today, it's also allowing women to have a seat at the table. And one of the most important things there is making sure you can continue your education. And if we think about the number of women and girls, and I think my colleague Kathryn was talking about that earlier, as we're sort of recovering from COVID, to some extent, what we're realizing is thousands of girls have been lost to the education system because of unintended pregnancy. And so that's really what keeps me going and keeps me motivated. And while there are some opposition I'll talk about in a moment to the work, there's also a huge amount of support for the work that we're doing, and the need is very, very clear. And for me as well, you see that dynamic changing. There's been a lot of interest in the press around teenage pregnancies. There's been a lot of outrage about that as well, and frustration. Mm-hmm. And that, for me, is showing the tremendous support for our work.
Okay. Now, I do understand, of course, with these issues, the best way to demonstrate or explain would be through experiences. So I'm going to digress a little bit from my questions and ask you, what experience have you had that would best embody that restriction or opposition to some of these elements of women's reproductive health?
So we face quite a lot of stigma, and I think Evelyn was talking about this earlier. We face a huge amount of stigma with regards to our work, and what we really see is people criticizing, that we want to, for example, offer services to younger people. Now, what is really coming up against this is obviously the data. So this is sort of one of the areas of frustration we see, and we do actually have really support. We work closely with the government. We provide public sector support and training to the government providers as well. But where we see some of the frustrations is, social media attacks, for example. We see quite a lot of criticism. And with those individuals who do criticize us, we often see quite a lot of hypocrisy as well, where they will also be people who come and seek services from us because, like Evelyn said, it's high quality services. We offer really good, confidential, comprehensive counselling. We ensure we involve the male partners wherever the women want to do that as well. So it's quite interesting, and we see it on a daily basis, and particularly our providers see it as well. They'll get them sometimes with within their societies for the services that they're providing, but at the same time, tremendous support. So we see it very, very double-edged. But yes, it can make life quite unnecessarily difficult because everybody sees the need for these services out there.
Now, so as a woman leader in the space of SRHR, how do you mitigate the opposition space to ensure continued advancement of women, sexual and reproductive health?
Well, like I'm saying, we see enormous support for our work. Today, asked the average Kenyan, 1.4 million people are walking around with a method of family planning or contraceptives by Mary Stopes, Kenya. So the services we're providing are really, really significant. And we don't let a small number of these voices that oppose our work affect the work that we're actually providing. We rise above that and realise the importance of what we're doing. And what we're very proud of is that we prevent women and girls going through unnecessary or unsafe abortion. We are opposed to any woman going through that. It is life-threatening and it deeply concerns us. And that is what we really need to make everybody aware, that we do not want any woman to be dying from an unsafe abortion. And we stand in solidarity and partnership with all our partners, and there's a huge number of them and fantastic organisations, some of which are represented today, as you can see, to ensure that women's rights remain at the forefront of everything that we're doing. So that's really how we sort of mitigate. We mitigate by doing and showing and partnering with everybody, including the government of Kenya, to ensure that we're keeping women alive.
And as you implement programs at the national and community levels, are there, at the risk of repeating yourself, are there any experiences that you'd like to share on that?
Sorry, can you just repeat the question? Sorry, 2 seconds.
When it comes to the implementation of health programs at the national and community levels, are there some experiences that you'd like to share with us, given that you're an expert in the areas of family planning, reproductive health, maternal and child health?
Yeah, absolutely. So there was commitment made, including in Kenya, but globally, to the FP 2020 goals. And it's great to see that Kenya hit those goals. And back in 2016, we'd really hit the number of contraceptives that we were trying to get access to the population across the country. But unfortunately, since about 2016, it's stagnated. So while we have made really solid progress and family planning and contraceptives are more and more widely available, it's not actually increasing over recent years, and COVID has seen that affected even more. So what we've seen, particularly at the county level, is there's been some real challenges, and we've talked about this a little bit today, is around the provision of commodities and the availability of the services that a woman wants. So what we see typically, for example, is may have been made aware of her reproductive rights and that she is able to get a family planning method. She may have even been able to do the research and realise the method that she wants. But where we see loads of challenges are the availability of that actual method. So she may go to a health facility and say, okay, I've made the decision to have an implant. I don't want to have any more children for a few years. And when she gets there, she finds an untrained provider or the commodity that's lacking as well. And again, this comes back to the investment that we're making in the field of sexual and reproductive health and making sure that those services are readily available and the information is readily available as well. So that's typically some of the frustration we see. And if I share another one as well, it's really a barrier, and we've talked about this, and Marianne's a real expert on this, around young people. And we see for them a barrier really is being able to pay for a service. So as was talked about, a lot of women and girls go for a private facility, but then frustration comes for them that there's a cost to a service if you go through a private facility, and then that becomes incredibly limiting for them, and sometimes can mean that they don't want to or are unable to access that service. So that's something that we see day in, day out. Fortunately, we run a lot of donor funded programs and are able to offer free services. And again, when we work with the public facilities as well, women and girls are able to access free services through those facilities as well. But it's something that we see very regularly and is very concerning for us as well.
Okay, and I you have already touched on the issue of challenges, but just briefly, is there anything you'd like to add in terms of public health and the challenges women face, especially in advancing global SRHR health?
Well, I think the challenges for women are sort of everywhere. I mean, it's not exclusive to public health, and it's in all walks of life and across the world as well. I mean, globally, we're still 217 years away from having pay parity, for example, which is absolutely ludicrous when we think about it. If we continue the way we're going, in 217 years, we still will not be paid the same as men for the same work. And what we really need to think about is why is that happening? And a huge reason for that is women and girls falling out of the education system, like I've said, due to pregnancy, but also the lack of sort of priority for giving women time off during their pregnancies, ensuring there's a conducive work environment coming back. And what I've sort of faced through my career as well is it's a constant battle. There's constant setbacks. You know, we've made progress over recent years, and then COVID has exacerbated the gender gap hugely, and also within the field of public health as well. We do still live in a man's world in many of the walks of life, and government is really skewed towards men. And even when, you know, we think about the whole of the world is sort of designed for men. Our mobile phones are too big for our hands. Our seatbelts are designed for men. I've recently read a book on this, and I just get more and more frustrated all the time. But when I look at my colleagues on this panel and the colleagues I work with every day, it cannot be luck that there are so many brilliant women who are fighting in the same space. So it does make me feel incredibly optimistic about the future. There are so many fantastic women, and particularly in Kenya, it just seems to be an abundance of brilliant women in this space. So we've got to keep fighting. We've got to not get tired. Unfortunately, women do tend to not get so tired. So I'm pretty optimistic about the future.
Okay, I just love that example about the mobile phones, because I recently bought this phone and I kept asking myself, why is it so big? Yeah, it makes so much sense. And over to you now, Marianne. I'd like you to point out some of the challenges as a female leader in sexual reproductive health space that you have faced and that you continually face. How has it been?
Thanks, Trix. So I will highlight two of the major challenges that I think I not only face, but also my colleagues who are young people do face. Uh, the number one challenge is making referrals at the community level. When you make referrals with regards to safe abortion referrals, or basically access to SRHR services referrals at the community level, sometimes we experience a lot of stigma. We also experience a lot of labeling. For example, you're immoral, or if you may allow me to use Swahili, unaribu watoto wetu, unaribu vijana wenzako. And you see,
Okay.
this type of labeling is not good, because it creates an environment where people cannot access accurate information with regards to their sexual and reproductive health rights, and it also limits them from accessing, quality care with regards to their SRHR needs. So that's one challenge that we face at the community level: a lot of stigma and a lot of labeling when we're doing referrals. And also, another challenge is the challenge of meaningful youth engagement. What I mean by this is, nowadays you see organizations coming up and saying we want to meaningfully engage young people, and we want to include them in our programs, in our creation of work plans, in our development of, objectives for the year. But unfortunately, the unfortunate part is that some of these organizations will only want to engage young people for numbers, and not to actually, uh, not to actually give them an opportunity to maximize on their talents and their talents and their giftings. And which is really sad, because many youth advocates have been complaining about this, especially during the COVID period. uh, so many young people were engaged in developing work plans and objectives for organizations, but when it came to the implementation phase, so many youth advocates were put on the side. And in my opinion, I don't think that is meaningful youth engagement in the SRHR space. But rather, it's limiting these young people from showcasing their potential, from maximizing their leadership qualities, and basically it's also limiting them from, uh, being productive members of the society. So those are the two challenges that I have not only faced as Lisa, but also
Mm-hmm.
many of my colleagues who are youth advocates face on a daily basis.
Yeah, to get a clearer picture of the stigma that you talked about, far from the labeling, if I were in your shoes and I walked into a community, what other ways would that stigma manifest in?
Sorry, kindly repeat the last bit of your question.
Yeah, in what other ways other than labeling would the stigma manifest in from the people, society, or communities that you work with? And how have you experienced this stigma aside from labeling?
So I'll give an example.
Good.
Around, I think, November, I had a really close friend of mine who was physically attacked and abused, just because she made a referral for a young girl to seek safe abortion services. She had gotten pregnant as a result of sexual abuse, and the perpetrator was actually someone who was well known at the community level. So first of all, the perpetrator went free, and when and no justice was given to this young girl. And when she seeked for safe abortion services, she was referred to obviously a good facility. But now my friend who did the referral was attacked because, first and foremost, she was told, "Why are you inciting this young girl? Yet we know very well that our constitution provides for the opportunity of a victim of sexual gender-based violence to access safe abortion services." So she was attacked for doing that, and she was also attacked for for approaching and basically confronting the perpetrator and wanting community members to confront this perpetrator and make sure that he's arrested. But the unfortunate happened, and my friend was attacked. So these are some of the challenges that we actually face. It's not just labeling, but
Mm-hmm.
actually your entire, being is attacked. You're attacked psychologically, physically, emotionally. It's really not easy at the community level. And that's why, for example, like myself, where I live and where I serve are two different places. This is for my own security, and I always
Mm-hmm.
encourage other young people to do the same. But sometimes it's difficult not to serve in the community that you live in, because some of these experiences you witness them on a daily basis, and you just want to change the lives and improve the lives of the people that live around you.
Okay, okay, great. And remember, if you're watching us via social media, we have a provision at the end for questions. So we'll have a Q&A session if we have some time to spare. So ask questions. We will be posing them to our esteemed panelists. And still on you, Marianne, the Kenyan leadership and governance continues to exclude women. How does that affect the upcoming young women leaders? We know about the two-thirds gender rule that was a great plan, but never actualized. There's very low political goodwill when it comes to women. How does that affect the upcoming young women leaders?
um in my opinion, I think it's actually really sad that we don't try to nurture the talents of women in leadership, and more so young women. Our government, our constitution in Article 27 pretty clearly states that women and men all have the right to equal treatment, including equal opportunities in political, economic, cultural, and social spheres. So when we limit women and girls from taking up leadership positions, we are basically limiting the development of our nation, and
Indeed.
not not meeting the two-thirds gender role, and the president basically not taking up the recommendation from the chief justice when he suggested of that parliament should be dissolved until the two-third gender rule is met. I think that was a sad thing to watch, and
Yeah.
it was basically, in my opinion, it was basically degrading the power of women and the power that women have. If you, for those people who have read the BBI proposal, it proposes increase of women participation and representation at the Senate level. Some may see this as a win. In one end, it could be a win because there'll be increased representation, and these are women who will have opportunities to influence policies. But the unfortunate side is that being at the Senate level does not directly pass laws. It's not like being at the legislature level. So you
Mm-hmm.
see, I think our government, in one way, um, they want to blindside women. That is my opinion. And I think that as women, we can always gather and be one front and one unit, instead of all people championing for women's rights and women's representation in different organizations. I think if we all could come and be one force, we can actually be able to achieve not only the two-thirds gender role, but we'll be able to ensure that no government committee is created without adequate women representation. And even at the local level, um, any decision being made, a woman must be there at at the organizational level, ensuring that we create spaces for women to lead and make
Yeah.
adequate decisions. I hope I've
Yeah.
answered
When
your
you
question.
Okay, and as we talk about those challenges, what makes it hard for you as a young female leader? Are the challenges unique to when it comes to your age group rather?
Of course, for my age group, it's extremely challenging. One, no one takes you as seriously as you present yourself, because they'll be like, "Oh, you're a woman, as in, or right now, this at your age, you should be trying to get married, not let me use Swahili, not kufuatana na wanaume kwenye boardrooms, or you have young children. Why don't you go and take care of your children? Why don't you go and be a wife?" Recently, a friend of mine was told by the husband, hakuwezi kuwa na two politicians kwa nyumba moja, either uchague kulea watoto ama ama uende kwenye kiwanja na ufuate mambo yako ya leadership. So it's really really challenging. It degrades us as women on a daily basis, but I think there is still lots of opportunities for we young women, both at the political and at the civic level. We need to leverage and partner with our male counterparts, because this might sound weird, but if the men have the seats, once we partner with them, it will be easier for women to penetrate through. So we cannot develop a victim mindset by embracing the discrimination that we face on a daily basis, but basically embracing a victim mindset and ensuring that once a woman gets an opportunity at a particular level, you create space for other young women to continue with the leadership.
Okay, and last but not least, how best do you think as a country we can increase opportunities for more women to be in leadership?
I think I have mentioned some of them. So
Yes, already. Yeah.
one of the opportunities we can leverage on is male championship. Even at the community level, when we are working, we always say that despite the fact that SRHR mostly affects girls and women, if we do not partner with male champions, it will be difficult to make sure that the agenda goes through and the agenda is bought in. So even when it comes to leadership, let us embrace male championship, ensure that those men leaders who are champions for women and champions for gender equality, they are our partners, they are our allies, and we work hand in hand with them to ensure that we create more spaces for women and more opportunities for women in leadership. and not just women, but young women.
All right. Thank you very much. We are at the tail end of our conversation. Thank you so much for the very insightful comments. So as we head towards the very end, I'd like some closing comments from all our panelists. I'll start off with Evelyn Opondo. What would you say on this International Women's Day as we wind up the conversation?
Thank you. I think for me today, I just want to take this time to celebrate all the women and, everything that we do to keep the society and our families running. And I want to take, to say a very special thank you to all the women who fight so hard to push patriarchy, to ensure that women are enjoying their rights, receiving health care, and attempting to get women to where they need to be. As women rights defenders, we celebrate you. As providers of services that are stigmatized, we celebrate you. We thank you all for your contribution to the struggle. Thank you.
Oh, okay. And Dr. Kathryn, your closing remarks.
I think I'll say that we live in difficult times, and as women, maybe more difficult than anyone else. But so maybe mine is to appeal to every woman that once you are in any kind of position of influence, that your role is not just to perform while you're there, but also to make sure that you uplift and you give a leg up or a hand up to more women that are in your footsteps and that are behind you. That we must never be comfortable with where we are and the privilege that where we are brings, and that leadership demands that we carry our fellow women with us, and we open doors for them, we mentor them, we point them in the direction of opportunities, and we challenge the status quo and the environment in which we are once we have the power, so that other women can successfully follow in our footsteps.
Okay. And Ms. Hodder, what's your closing remarks?
Thank you. Today is a day for us all to be really proud. Proud of what we've achieved, proud of what we are as women, proud that so many of us are mothers, we're partners. We keep everything running at home, we keep everything running at work. And like my colleague said as well, we work in partnership with each other, we're friends with each other, and we can't do any of this alone. I'm incredibly proud to be an advocate for women's rights, for leading an organisation with such tremendous staff, such courageous staff as well, and to be working, like I said, with partners, with advocates, with human rights lobbyists, with lawyers, with all these impressive people. So it's an incredibly proud day for me, but it should be for all women and everything we've achieved as well. And it's exciting to see the future women, like on this panel, who are going to be taking over in the future. And I agree with Kathryn that we need to absolutely motivate and inspire women to be taking over from us as we sort of get later on in our careers as well.
Okay. And last but not least, Marianne.
Mine is just to celebrate all the women across the world in the various fronts, in the various spheres of life that they are in, and to acknowledge their boldness, to acknowledge the strength, and basically to tell all women that there is power in your voices. So take confidence in your voice, take confidence in your talent, take confidence in your giftings, and don't let anyone put you down. Let's continue taking the world by storm, despite all the challenges that we face, because women are naturally more vulnerable to some of the challenges that the world experiences, but women also are the strongest beings. So let's uh, maintain our confidence in ourselves as women. Let girl power win, and let girl power rule.
Okay, thank you so much to all our panelists. Thank you to all those who have been viewing us from the beginning or at whatever point you did join us. Just to remind you, my name is Trix Ingado. I am a TV reporter and anchor at KTN News. If you want to reach me for anything, my number is in the chats, but of the private chat. But just thank you so much for making this conversation really memorable and giving value to all those who were viewing us. Shukran sana. And I think that's where we end it. Evelyn?